Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. I am delighted today to have my friend Dr. Roger McFillin back for the second time on the podcast. Thanks, Roger, for being here again.
Oh, it's an honor to be with you. I love having the conversations with you, Kristin.
Always so fun. So for those of you who don't know him already, Dr. McFillin's a clinical psychologist and the executive director of the Center for Integrated Behavioral Health, which is in Bethlehem, Pennsylvania, right down the street from me. He's also the host of the popular Radically Genuine podcast, which if you don't know it, now you know it, and you should start following it. He's board certified in behavioral and cognitive psychology by the American Board of Professional Psychology, and he's a diplomate of the Academy of Cognitive Therapy, specializing in cognitive behavioral therapies for the treatment of post-traumatic stress, eating disorders, and anyone struggling with anxiety, mood, and chronic suicidality. Dr. Roger McFillin is also a passionate educator, and this is where our paths first crossed, I think, during your 16-week family dialectical behavioral therapy course, which was totally impactful for my family in a great way. But that's not the only place you teach, right? You've been featured as an expert on numerous podcasts other than mine, internationally, and on several national media outlets, including One America News Network, National Public Radio, and Time Magazine. He's an outspoken critic of modern medical establishment practices, and in particular, the antiquated diagnostic system used by psychiatry, the prescription drug-centric culture in psychiatry, and the widely accepted treatments in psychiatry that can cause untold harm and undermine the development of resilience. He recently founded the Conscious Clinicians Collective, which we're going to talk about. It's a nonprofit geared at helping folks connect to providers who are doing true informed consent and values-based medical practice around psychiatry issues. So we're going to talk today about whatever we talk today. I invited you back, Roger, because you had this really awesome email probably a month or and a half ago on fear. And it just struck me as so relevant to what I feel like is one of the biggest issues going on in the world today, personally. Fear that keeps people from learning what they need to know about their own health, from asking important questions of their providers, from challenging established dogma. And so that's where I kind of want to get to. But more importantly, because you're always delving into such interesting topics, I just want to hear kind of what's top of mind for you these days and sort of explore those things because they're always relevant.
Yeah, good question. Thank you for having me on again and for that wonderful introduction. I am about to present in front of the FDA. It's a public hearing on Monday, July 21st, regarding SSRIs for pregnant women. It's an opportunity for 9 panelists to be able to present their perspective and understanding of the literature to better inform the public about risks and benefits of that drug, SSRIs. When you speak about fear, these are opportunities, I think, for me personally to enter into a conversation with a group of people who probably have different views, or at least some I know will have different views than I do. And what happens around education, especially medical education, as you well know, is that there is so much systemic bias and funneling of information into the education of medical professionals to get them to see treatments and disease from a perspective that serves a certain industry. And I think that's one of the reasons we're facing a chronic disease epidemic in the United States, as well as a mental health epidemic. It's because of the way we frame and understand health, as well as health-related problems in recovery. The limitation of that is what keeps us stuck, and the degree of groupthink that exists is what limits our ability to break free from these paradigms and to be able to innovate. And so my opportunity there is to try to challenge the paradigm. You will have people come on that panel and they'll start talking about things like major depressive disorder as if it's a discrete medical condition, instead of understanding that it is an umbrella term that now is widely applied to all different types of conditions, some of them legitimate medical conditions that are misdiagnosed, others just the emotional reactions of living. And what we've done, unfortunately, is we've created in fear. And it is fear provocation that is leading women to stay on a drug that they should have never been on in the first place, that our government should have never approved for safety and efficacy reasons, while they are pregnant. And we have really good science about the impact that a drug like an SSRI has on a developing baby. The serotonin system being so critical, especially in the first trimester. And women are never provided the opportunity to consent, because if our physicians and our medical professionals and our mental health professionals who are recommending that drug are not informed, how can they provide women of childbearing years the information to be able to make an informed decision about something like this? And it starts with the way you frame it. You don't go into a medical center and get an objective test to determine that you have major depressive disorder. And so they're going to try to reduce this to, they'll use terms like disease, treating a disease. We have this data. They'll use voodoo statistics to show that there is some subpopulation that may respond to this drug. But we're near 40 years in on this drug on the market. And when you're 40 years in, you have a lot of information. You also have tons of case reports. You have tons of clinical experience. And then if you become obsessed like I have in this area of health, you have exposure to all the suppressed science. And you realize how physicians are funneled information to fit a narrative, to fit an industry. And so this is my opportunity to face that fear, get in front of the American people. It's going to be live streamed. The FDA has done a number of these live streaming panel discussions, and they're getting tons of views. And this one is going to even get more exposure, because we're close to 1 in 4 women being on a SSRI right now. 1 in 4. Even if you believe that there is a subpopulation of the most severe depression that can respond to targeting serotonin, no one can say that the overwhelming majority of people taking these drugs are exposed to unnecessary risks and unnecessary harm to their baby. And this is a watershed moment, in my opinion. It's historic, because the US government has been unwilling to enter into these discussions previously. Experts would be those who are on the pharmaceutical dime, those who accept money from pharmaceutical companies to do this type of work, and whose entire profession is dependent on the prescribing these drugs. So they're actually bringing in experts from other countries, ones that I know well, who've been part of this movement for 20, 25 years. 2 of them are from the UK, for example. So they're willing to say, hey, there are people who've been doing this work outside of the United States, and we're going to have them come in and make sure their voices are heard. Someone like Dr. Adam Urato, who's a maternal fetal medicine practitioner who is from Boston and has been trying to communicate this for 2 decades about the harms these drugs have on a developing baby. His voice now gets to be amplified. Most people don't know who he is. He should be well known. So 99% of mothers are not going to have not received informed consent. That's a violation of law. That's a violation of ethics. And I'm hoping that this meeting on Monday changes the conversation around this, and we start moving in a direction where this country wakes up to the experimentation that we're doing on more women than men. And that's another question. Why are so many adolescent girls being placed on these drugs? And this is what happens, is you start putting teenage girls on drugs for emotions, for normal human reactions, for premenstrual mood changes, for a range of health effects that you haven't investigated, for the consequences of hormonal birth control. I mean, there's a range of reasons why we're drugging girls, but those girls become young adults. And then they have that label and they interface with the medical system. And then the medical system tells them, oh, well, you need to stay on this drug to prevent postpartum depression. Well, there's no scientific data to support that. So where do you have the right of making that claim, of making that statement? You're fear mongering. That's not science and that's not healthcare.
Well, I want to put a pin in that right now, because I think part of what happens for physicians is that they're also afraid too, because they believe this is a safety net, right? They've been taught that these things are a safety net. They're going to keep people from killing themselves. They're going to keep people from having postpartum depression, which can be very dangerous to mom and baby. And they believe that they're doing the right thing by continuing a safety net that they believe in, right? So it's fear of not having a safety net, I think, that also drives that.
That's not how you make critical decisions around someone's health.
No.
You don't make it based on fear. And then listen, we're going to go there into this meeting. And I had a pre-meeting on this, so I know what I'm going to face. I know the mentality of a few people who will try to argue that there's some benefit. We can't let doctors off the hook. You have a responsibility to your patients. If you have questions, if you're going to prescribe this drug and it's being widely prescribed in primary care centers, then you have to educate yourself beyond the pharma narrative. You have a responsibility to those patients. Ethics trumps law, and ethics trumps rule following. And this is the problem that we've put physicians in, is we've created these guidelines that are influenced by the pharmaceutical industry for the major medical organizations. And if they act outside the guidelines, then they put themselves liable. So these drugs don't protect against suicide. It's quite the opposite. We already have a black box warning for more than double the risk for suicide. I think it's much higher than that from the data I've examined, but you're prescribing a drug to suicidal people or to prevent suicide where the data demonstrates it's going to increase that risk. Tell me how that makes sense. Make that make sense to me, right? So when a doctor says to me, well, Roger, I understand where you're coming from, but what do? I have 15 minutes with my client. If I spend more time with my clients, I start falling behind. And then I have to talk to a bean counter who's running these large hospital organizations that's focusing on efficiency. And these are protocol medicines. And I have to follow these rules. If something happens to that client and I follow the standard of care, I'm protected. If something happens to that client and I don't follow the standard of care, I'm liable. So who gets to determine the standard of care, right? And that's where we've done a disservice in this country, because the standard of care is not science. And that's what we've convinced our physicians that this is gold standard science and not pharmaceutical propaganda. It's pharmaceutical propaganda. But listen, I understand, Doc, that you're very, very busy on Monday through Friday from these hours. Well, then you need to dedicate a period of your time on the weekend to investigating the history of this drug you're prescribing, of understanding the harms. And then you have a responsibility to inform the client, right? You can say that there's a protocol that says I can offer you this drug, but I want you to make an informed decision. Here's what we do know. There is a black box warning. Here is the potential benefit for this. Maybe there's a numbing or an emotional blunting, which you could potentially view that in the short term as something that's relieving. But in no way is that an antidepressant effect. That's numbing or detaching you. And there's consequences to that, especially when all your emotions are equipped to help you to bond with a child. And there are unknown risks to your baby. Here's what we do know, right? None of that happens, right? And that's why we're in this position in our culture. And this is why institutions like our medical system are crumbling. And to me, it's a tragedy, because you really need to be able to trust your medical professionals. That's a very important role that we have in society. And when that trust starts to disintegrate, well, then you see the chaos that exists. You don't trust anything anymore. You don't trust anybody anymore. And that's an interesting place where we're at in the United States culture. It's just this widespread distrust of people in authority.
So let's talk about where we are right now in United States culture. How is it that in 2025, July 21st, you, of all people, with the views that you have and have put out there in the world so clearly, that are so anti what the standard sort of status quo is in medicine, how have you been invited to be on an FDA panel? Tell me how that came to pass.
I can give you a standard bullshit answer, or I can give you what I think really happening.
Well, you have the words radically genuine behind you. I think you should go for the real answer, Roger.
Okay. The real answer is that I have learned to quiet my mind, pray, and connect to God. And I ask to be in a position to be able to do God's work. I've asked to be in a position to have my life have some meaning or purpose greater than just me. I know that I've incarnated here for some reason. I'm passionate about this. I borderline obsessed about some of these issues, and I've just surrendered for the opportunity. And there's no reasonable or logical explanation that just a psychologist in Bethlehem, Pennsylvania, in a short amount of time gets to sit on an FDA expert panel, right? But it does speak to what I think a lot of people are craving, is just authenticity and passion. I won't, I didn't go to medical school. I didn't have to play the rules. I didn't have to play the game or follow the rules, right? I'm my own boss. The only person that I feel really that I have to be responsible to is a higher moral authority. And that's not even a person. That's like a spirit. That's an idea. That's a code of living, and that gets demonstrated to every single patient. So I generally have no intimidation by anyone in a position of authority, and I am so free to speak my mind. So what you're hearing from me is absolute freedom. I don't care. I don't care how I'm going to be perceived. I don't care who I'm going to offend. And that's what's going to make me different on this panel. This is why I'm going to ask people to tune in. And if we're going to learn to, again, trust each other and love each other again, you're going to have to be able to determine authenticity and an energy of love versus, people who have obtained a position of power and authority by following the rules very well and respecting that hierarchy and then communicating by the rules in which they were taught. I just got off of I just posted a podcast episode last week. It was about a 2.5 hour debate with a Columbia University professor of psychiatry. And he is the definition of groupthink, right? He expects everybody for him to say the data is clear, or we know this by now, or the research shows, and never have to back that up. That he's just in a position of authority, can make those statements, and you're just supposed to accept it, right? Why? Because he's a professor of psychiatry at a major academic institution, an Ivy League institution in New York, Columbia University. So he's an authority, right? And then you see when people like that get challenged, they don't know how to handle it because you're not supposed to challenge them. He didn't expect to come and sit down with a psychologist in Bethlehem, Pennsylvania and be challenged. You're just supposed to accept it.
Wait, what was he expecting? Had he not watched any of your podcasts?
I have no idea. He reached out to me. He wanted to be on my podcast. So he came from New York to speak to me. Now, he probably thought he was going to talk about his research, which is mental health and violence. But when he's developed an entire database that is used, like he communicates this like in Fox News or CNN. He communicates whether mental illness or certain mental illnesses are associated with violence. He makes statements about guns and gun laws. And he thinks that's just going to go unchallenged. But the fact is, his entire research is based on media reports. Not one person that is labeled as mentally ill was ever investigated by him or anyone on his team or evaluated by a physician. Can you imagine not being able to operationally define a construct in a research study, providing a label to it, stating that that label is valid and reliable, and then communicating it to the public that we have findings and we can use those findings for public policy, like restricting one's freedom to obtain a firearm? That's exactly what psychiatry does. I mean, it's the same thing that's going to happen in this FDA hearing when we don't operationally define what depression is, right? When you can't operationally define a construct, it's everything you say after that is unreliable. And that's what people are going to forget. So people start saying, there's no major depressive disorder. That's a label that we've created. There's no test for it. So you can be labeled with major depressive disorder for having an endocrine disorder, for being sleep deprived, for being nutritionally deprived, for being on your phone too long, for dealing with loss, for having a trauma reaction, because none of these conditions are not explanatory. They're descriptive. And as you know, as a physician, how do you solve a problem unless you know what the problem is? Right? I think, Kristin, all your entire work is trying to identify what real problems are and try to get people to solve them. But we have a medical system that is okay with trying to mask that problem. Although every symptom, they call it symptom, everything that you experience, sorry, you hear the passion because I'm preparing for this. Like, this is all I've been thinking about.
No apologies required. This is perfect. Go on.
We mask signals. Like signals that are designed for you, not only for your health and well-being and your survival, but signals that are also necessary for your transformation. Emotions aren't symptoms. Emotions are signals. Right? And so, yeah, you may have if we're gonna talk just about the physical, yes, those symptoms that you identify may be your body screaming out for help, but they're always happening for you. Same thing with your emotional reactions. They're indications that there are things in your life you have to face, and they are powerful energies. Powerful energies. My obsession right now is really looking into biofield science and looking at all this suppressed science that exists in post-material science, because I refuse to get into a time portal and jump back to 1999 and then act as if that time still exists.
Wait, hold on. We gotta define these terms so we know what we're talking about. Tell us what you mean by biofield medicine. Tell us what you mean by post-material science so we know kind of what we're moving into.
All right, I'll try to break down some complex science. This also includes a burgeoning field called psych neuroimmunology. So it's basically going to study the impact on consciousness, your immune system, behavior, disease. Okay. So I want everybody who's listening to see themselves as an energetic being. Okay. One that we can measure, right? Just like I'm talking to you, Kristin, where are you located right now?
Allentown.
And I'm in Bethlehem, right? We are tuned into a frequency and we are communicating to each other. Just like if I get in my car and turn on Sirius radio, there are frequencies that we cannot see. Same thing with EMFs, everything, right? There's a field that's communicated or that exists. We are a field as well, one that can be measured. There is a quantum physics, a quantum reality, a quantum science that is robust. And we know that energy can impact matter. And we know that from a scientific perspective or a health perspective, that we are emitting a frequency and we are emitting an energy. And of course, this has been documented, this has been documented for centuries, right? If you look about Chinese medicine or energy-based medicine, Ayurvedic medicine, cross-culturally, right? These very complicated constructs have been communicated as if there's a greater force or a greater consciousness that downloads intelligence to get human beings to evolve. Okay, so when I talk about biofield medicine, I am interested to know the impact of fear on your body. not, we already know that the impact of fear has psychological consequences. I mean, it's clearly people enter into the system, people come to see me because they're afraid. You know, they're afraid of losing their loved ones. They're afraid of dying. They're afraid of the next disease. They're afraid of losing things they have. They're afraid of their finances. They're afraid of war, right? And what this does is that fear is such a powerful control mechanism that it keeps you stuck in almost like a slave-like state of automatic processing. It fixates your attention onto everything that could be wrong with you. And as far as being able to measure a field, and energy is, or emotion is energy in motion. When you're in a lower vibrational state, fear, shame, low mood, it impacts you on every level. Your spiritual being, your physical body, and then of course it's emitting with other frequencies. So you are then interacting with your loved ones and you are influencing them. Mm-hmm. So post-material science would say that we can measure things that are outside our five senses. Okay, so I'll give a good example of this. Columbia University in their post-material science lab, Lisa Miller. I always forget her name, and this is the first time I've been able to give her credit. Lisa Miller up at Columbia. She's studying things like this. Okay, they're going to set up scientific experiments that meet, the scientific method, empirical scrutiny. So they take a participant and they put them in another building where they're under an fMRI scan. Okay. And then in another building, you bring in an energy healer, an indigenous healer, somebody who has been doing energy medicine or comes from another culture. Okay. And you have that person who's a healer cultivate energy, love, and try to connect with that person in another room. We can measure that on an fMRI scan. The parts of the brain get activated while that healer is interacting in consciousness. Okay. So when I say in consciousness, I'm going to say your perception of reality, your connection to the now, what you understand. So if you close your eyes and I asked you to travel to Europe, you can go there if you've ever been there. And even if you haven't been there, you can get an idea of what it would be like. Or to place yourself on a beach. Right? That affects the body. Like what we create in consciousness is affecting the entire body. So what happens then when we live in the past, when our mind is full of judgments, worries, focusing on anything that can be wrong with us? What are we creating in consciousness and what impact does it have in matter? Other important science is this, and these are published in journals. When somebody is sent home from Western medicine to die, when they're told they have stage 4 cancer, and there's nothing more that modern science can do. And then they go and they make peace with people in their lives that they harbored resentment towards, where they did not forgive. And they tell them they love them. And they resolve these conflicts that were burdening them throughout their lives. They release energy. They cry, they grieve, they hug people. They have a new realization about the value and importance of love and relationships in their lives. And then the tumor dissipates. It's gone. They go back for a scan, and it's what's the medical system calls spontaneous healing. Mm-hmm. These are in medical journals. Mm-hmm. And it's interesting, like this goes back to fear. When you interface with the medical system, they don't want to provide people hope. They will provide like data or statistics. So people don't get their hopes up. And somehow, believing that benefits them, to not give them false hope. Well, what impact?
Well, it protects the physician, right? Because
Okay.
that's a fear-based, I think that's fear-driven as well. Like, you don't want to be wrong if you gave them fault. If your hope ended up being misguided, or if it just didn't work out, even though you all had hope, you could be liable for promoting something that was inaccurate.
So fear-based consciousness is part of our entire culture. I had a radiation oncologist on my podcast who's been able to witness these spontaneous healings, these miracles, right? And she communicates it beautifully. She says that the people that she's seen heal viewed their disease from a completely different perspective. They viewed their cancer as a gift, as a wake up, as a signal. So first of all, life is time limited anyway. We're only going to be in this body for a period of time. So this isn't about life or death, because I don't believe you die. You are an energy, you are a soul, you are eternal. But yes, the time in this body is limited. So sometimes that cancer or that medical condition is a wake-up call to the individual to realize what is really important, to know themselves better, to deepen relationships. And there becomes an expansion of consciousness. They see everything different. Now there's regret. Like, if they would have woken up early, if they would have been able to come to these realizations at other times in their lives, then they could have experienced life differently. But the truth of the matter is they couldn't. That's why they're here. And when you begin to view that, you view disease from a different paradigm, and you're willing to shift, right? That like everything is happening for you. Then I think you put yourself in a better position to heal, if that is what is supposed to happen. Okay? You fear death, you can't live. And that's where a lot of this fear is people fear dying. And I say, you really need to fear like living. Like that's the only thing I want to be afraid of, not meeting my highest self, what I'm capable of experiencing in this life. I think like depression is a lie. As a disease, it's a lie. And it's sold to you to keep you small. It's sold to keep you in fear, to not realize your true self. And I'm telling you, it's a spiritual battle. It's going on. It's evil. It's demonic. It creates in consciousness a fear that you have to rely on somebody else to be able to live a full life. Like, you become dependent on the professional help system. And then you think of a chemical made in a factory is going to solve these problems. And so I fundamentally, anyone who's going to communicate it from that perspective is doing harm and needs to be called out, because that's not what this is. And you're not protecting that person. You're not protecting them from shame or guilt. You're not pill shaming them or anything else that a fear-based narrative that you want to create to push an industry. No, that person needs to wake up too. And that person is capable of waking up. The depressed person who wants to die, they want to escape this body. They're not diseased. It's there to wake them up. And if we keep looking at these people as fragile, and what, you're just going to manage their mental illness for the rest of their life? You're going to keep them stuck in that energy state? And this is what we learn from post-material science. This is what we can learn from an expansion of consciousness and looking at really the innovative work that's happening around the world, is that when you maintain yourself in a low energy state, you are going to get sick. So energy has to be moved. You have to be able to face that pain, not chemically suppress it. You're going to create more sick people. You're going to create more people who are mentally ill. Do you understand? Like, this is what makes this insidious.
Yeah.
No one overcomes depression by drugging yourself out of it. Not with alcohol, not with weed, not with street drugs, not with food, not with porn, not with anything that's trying to influence the chemical nature of your consciousness to try not to feel anymore. That will make you sick. It's going to make you sick.
I agree with all that on a population level. And I will say, I know some people who will say that SSRI or that weed or that addiction was the break that I needed in order to heal and recover beyond it. What would you
It's
say?
a lie they're telling themselves. So I'll use clinical data. Okay. So the moment, all right, let's say you enter into a research study and you are going to be taking an SSRI, which will be called an antidepressant. You're going to be under clinical watch. You're going to interface with the researchers and the medical doctors. You're going to be taking note of how you feel, and you're going to fill out measures that are going to assess how you feel, how you think, how you behave, how you sleep. Okay? If you're given the placebo, you have the same, if not better, response than taking the SSRI. So, post hoc ergo propter hoc fallacy. After this, therefore, because of this. So you're right. There are people who believe that taking that drug or smoking that weed or something gave them the quote unquote break that they needed. And they're right. It did. But it's probably not what they think. It's not what they're attributing it to. It's more of a lot of other non-specific factors. Listen, if weed helped people overcome depression, right? Someone like me would be communicating, let's smoke more weed. It doesn't. If an SSRI helped people overcome depression, I'd be telling people to use this in the manner in which short-term it can actually help you overcome something. It doesn't. We don't have that data, and we don't actually have that clinical experience. But yes, someone will adopt a belief that they are broken, and they have to externalize it, and they need something to turn down a dial on how they feel, and they might attribute that to some kind of substance they took. But it's not different than the placebo group. So what's happening there? So why would you then expose yourself to a range of adverse health effects, side effects, real legitimate problems for something that you could get the same relief by doing something else? And that's the scientific question. Why would anyone do that?
Well, it's socially acceptable. It's something that your doctor told you would work. It's something that your family agrees is the right way to go, right? If it's a lie you're telling yourself and it's really just placebo that gets you the results you're looking for, it's a very socially acceptable lie. I think a lot of people need that. A lot of people are not willing to buck the system, to take a risk, to take what they feel is a risk, when so many voices are saying, don't listen to that guy, don't listen to that theory. That's non-scientific. This is the eminence-based medicine, right? That we were talking about earlier. This is the stuff that everyone believes because all the people who we trust seem to say it's true.
Yeah, I used to what fueled my passion and even my anger around this is that I saw people who went down this direction as helpless victims of almost an oppressive system. And one day I was deep into meditation. I don't know where I was, but I was not in my body. And I got this message, and it was powerful, and it's affected me. And the message was like not in words, but it was like in a knowing. And it was communicated to me that who am I? Who am I to view other human souls as victims? Who am I to take away their freedom, their agency, and their path? Mm. And it was my judgment, it was my judgment to see the world in terms of perpetrator and victim, right? Like these are the narratives that were sold to us. They're sold to us in movies. They're part of the matrix, right? It's to divide. and to divide people in those kind of categories. But what if that was their soul's path? To make that choice, to follow that authority, to make that decision and interface with a medical professional who believes certain things. And same thing with that doctor. One thing I have no doubt, I hope it's less than 25 years, but at some point that drug is not going to be made available. At some point, no one's going to take psychiatric drugs anymore. There's no doubt about it. It's a failed paradigm. It's reductionist. It's interfering with nature on so many different levels. Right? So at some point, whether the market pulls it away because no one uses it anymore, or we just, advance, or whatever that may be, there's going to be a point where we're not drugging 25% of the American public's emotions. Okay. And I ask, well, how are we going to look back at this time? Like, where are we going to be in our own evolution and consciousness and so forth? It's going to be used, like, this knowledge about what's going on right now is going to be used to advance us, right? And if I do believe we are eternal souls, and I fully do, no one's dying, everyone's just expanding, and it's energy that keeps up, then you can really love and respect people for making any decision that they do. They have that choice. You can take an SSRI. I just want to make sure people are informed, and that is part of my passion. That if you're informed and you know the risks, you have every right to make that decision and to live your life in that way. It's just that people are making these decisions uninformed, right? But it really does take away my judgment of it or my anger around it when I don't view people from a victim mindset.
That's so beautiful. And what a powerful and important insight. I remember having a similar one during my whole Lyme journey, as I was waking up to a lot of things in medicine that I now believe to be really harmful as opposed to beneficial, and just the exasperation I felt with people who didn't want to see it my way. And now I really have come to the same place, not through meditation, but through whatever, of just like, everyone's on their own path, right? I just want people to know what the options are so they can make the choice that's in alignment with the path they want to be on.
Yeah. I mean, one of the things I tell people is that your emotions are powerful energies. I believe they need to be moved and experienced. I do think we have to cut our energetic ties to our past if we're eventually going to move forward and live fully present. And at the same time, you have a right to take a drug that may induce emotional blunting, which maybe that's how you're desiring going through life. Yeah, maybe you do want to be blunted. Maybe you don't want to feel as much anymore. Now, as long as you know, like, there's consequences, there'll be consequences on your relationship. There'll be consequences on your health. There'll be consequences in your cognitive capacities. It's going to affect you to a strong extent, because serotonin as a neurochemical is a powerful one that interfaces with the entire body. There's bidirectional relationships with our hormones. You're undergoing an experiment, and you will probably pay the price down the line. And if not right away, some people experience that price right away. So if they make that informed decision, it's just that I've never met anybody who would make that decision if they fully knew. But if you still want to make that decision, respect their life.
If people aren't going to get this conversation from their doctors or their psychiatrists, where could they go to get information about risks and potential benefits of SSRIs, for example? Like, what are some good resources for people to do this work?
They don't exist. I'm telling you, they're only now starting to be developed. Okay. And how have they been developed? By a large community of harmed patients. They've started nonprofits. They've helped each other. This is what is beautiful about this community. And listen, it's a tidal wave. There are so many people who've been harmed by psychiatric drugs, and SSRIs in particular, that it is overwhelming the internet. It's overwhelming medical professionals. So there are certain nonprofits that exist, like Inner Compass Initiative. Um, there's a range of organizations around SSI withdrawal dependency. Um, there are organizations around post SSRI permanent sexual dysfunction. So what you do is the patient populations that have been harmed and have been screaming for research dollars or recognition and have been quieted, muted by the medical authorities, that's where you find the best information. Now, most people listening to this aren't going to spend 10 hours on a Saturday combing through research papers, right? I went down that rabbit hole for too long, right? Because that's part of the awakening, because you can't believe what you're reading. And then you find the court documents. And then you find the political history. Then you see the millions and billions of fines that are levied on the pharmaceutical companies for hiding data. But it's a drop in the bucket compared to what they're making. They own the flow of information. So you cannot do a Google search and get accurate information. You can't go to PubMed and get, well, you can get some stuff from PubMed, but it's just going to confuse you more, because 85 to 90% of the medical literature that clinicians rely upon to make decisions are systematically and fundamentally flawed. Well, what does that mean? That means the conclusions drawn don't even meet the data that exists in the paper. And how many people out there are trained to evaluate methodology? How many people are out there who understand statistics, right? So that's the problem that we run into. I hate statistics, but I can understand that there is a difference between a p-value, statistical significance, and clinical relevance, right? So if I provide somebody an outcome measure that is going to take into account a drug effect, and I compare it to somebody who is on a placebo who won't have that same sedative quality, that psychoactive effect, that emotional blunting, and then I compare it to a placebo group, and then they're both taking Hamilton Depression Rating Scales, and all at the end of this, the placebo group had a reduction of 9 points on the Hamilton scale, and the drug group had a reduction of 10 points or 11. I can say, well, that might be a statistical difference, but in clinical practice, it's completely irrelevant. You still have two people who are suffering the same exact way with like slight improvements. And those improvements look like they're from non-specific effects, right? They're being validated. They're being recognized. There's been a condition identified. They're interfacing with a professional. They're being taken care of. Well, the general public doesn't know that. Most physicians don't know that. They're not looking at it that deep. They're not even going to talk about it that way. So I guess this is.
Most physicians aren't, right? Some physicians are.
Yeah. Yep.
And some physicians are going to want to know. Those physicians are going to want to know about the CCC. So I think it's time for us to talk about that a little bit. Because even though there might not be one place to go now, there may in the future be some places to go. And that seems like it might be one of the places.
Yeah, this is about community. I honestly don't think change is going to happen at the government level. I don't know who believes that. That is a what's happening in there is is a fight for power. The fact that Marty McCary is willing to have this conversation is a testament to him and what Bobby Kennedy's trying to do there. But I mean, they're in for a challenge. I mean, they're going to get fought every step of the way in trying to facilitate change. So This is why you have to have these open conversations. But to your point, there are, actually, I mean, as much as I sometimes get angry at the way that physicians are trained in contemporary medicine, my experience with physicians is most people, their intentions are really good. Like they believe they're doing what's in the best interest of their clients. It's that institutional groupthink. It's the bubble that reinforces each other. That really infuriates me. And then it's fear, and it's acting. Ultimately, when you come down to it, they're having to make decisions. What's best for me and my family versus the person that's in front of me. And if we don't recognize that to be truth, then we're distorting reality. I understand that you're in significant debt from medical loans, and you got 2 kids at home, and you spent your entire life doing this, and now you're in a job. Then they go into these mental mind games, and then they begin to rationalize and think that they're doing something that's right. And so it's the ignorance of that I have a hard time tolerating. But there's a lot of people who've broken free from the system. They've woken up. They choose to go in alternative practices, provide alternative medicine, different ideas, you being one of them as well. And these people are special. They're way showers. They're guiding lights, right? We have to find a way to change this within our communities. We have to create an opportunity for these alternative health practices to flourish, and people who have ideas that are outside the mainstream, an avenue to be able to communicate it. And so the Conscious Clinician Collective is first and foremost trying to create a database of people to come together. Now, it's going to be a battle. I mean, it's something that, we're up against, like, forces and challenges that are really, really difficult. Even those who believe with what I'm saying, they're afraid to say it out loud because of what it could do to their career. So to put yourself on a database, that's even more challenging. But there's a lot of people out there in our communities around the country who don't believe that our emotional state should be drugged, who understand that even if you have a symptom of depressed mood, there could be a very legitimate medical condition that is not recognized in standard healthcare practices. We live in a toxic culture. Our food is poison. We're toxic ingredients all the time. That's affecting the physical body. And if you don't have an awakened medical professional that is skilled in being able to investigate root causes of health, do you know the vulnerability that exists for you just to be labeled as psychiatric? And for those signals?
Yeah.
So, I mean, that's where we're at. And so trying to create the Conscious Clinician Collective for people to go on this database. And so where the communities around the world even can search and find somebody to interact with. Because when I started opening up my levels of awareness to alternative ways of viewing our health, first of all, my health changed. It transformed my life physically, emotionally, mentally. And I'm so grateful for the awakening. I'm not that different from anybody else. I mean, I grew up in American culture and lived the American lifestyle. And I'm healthier at almost 50 than what I was at 30. And it's affected my mood and my energy and so much. Like, I don't slap on toxic sunscreen every time I go out into the sun. I mean, there's so many things that I do that has improved my life. So trying to get people together is the first step of the Conscious Clinician Collective.
So it recently launched, and the database is now accepting submissions, right? What's the best way for someone to get in touch with that and learn more about it if they want to explore?
thecccollective.org. thecccollective.org. We need more professionals. Like, we're getting community members signing up. We don't have enough professionals, right? And part of it's an exposure thing. I'm hoping, Monday, when I'm down in the FDA and the the degree of media attention that's going to be on that I can expose the Conscious Clinician Collective, because I think a lot of people are going to hear what I have to say on Monday. Even it's a short amount of time. I only have 5 minutes to present, and I'm allowed to then participate in the follow-up discussion. But I hope that's an opportunity where we can expose people to the CCC, just to get a community together. You're a board member, Kristin, we created the Conscious Clinician Compact. It's a declaration, right? And I think it's of the highest ethical standard. Like, if you were to just communicate to somebody at a high ethical standard outside of the nomenclature and classification system, then you would attest to the CCC, right? And this isn't just mental health is physical health. I mean, that's the crazy thing about all this, is that we separate in Western medicine into these categories, but like they're all the same, right? Like your metabolic health is clearly your mental health as well, right? Your sleep, physical pain, disease states, they're all integrated. Like, we can't break us up into parts. So, Kristin, you're just as much a mental health professional as I am. Bottom line.
Yeah, no, that's clear. I mean, and you know how I talk about people as being a tree of many limbs, right? The physical limb is usually what gets people in my office, but every other limb needs to be loved up and nourished and get healing too. No one leaves without a full limb assessment and treatment plan. Well, this has been great, Roger. Is there anything we haven't touched on that you feel would be important in this conversation for people to hear about?
You and I could probably talk for hours. So, I think today was good for what needed to be shared today. And if your audience is interested in, further discussions on this topic, I'm always willing to come back on.
Thank you. And I'm going to do my best to get this out this weekend so that people can hear it and then show up, because it's going to be broadcast live, right? Your conversation at the FDA.
Yeah, 10 a.m. on Monday.
Eastern time. So exciting. I don't need to wish you luck, because you don't need luck, but I'm just so grateful for what you're doing, Roger, and for the voice you're speaking and the information you're sharing. It's so, so important and needed, and I'm so happy to know you.
Thank you so much.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.